The ACL is also the proper name is anterior cruciate ligament. It's a very important ligament in the center of the knee joint that connects the tibia and the femur, which is the leg bone and the thigh bone. It is responsible for stability of your knee in the twisting position. And as you know, a lot of sports such as skiing, football, rugby, racket sports involve twisting, and it's perhaps the most commonly injured ligament. Yes, there is the capacity for the ACL to heal, but very often the healing is poor and it may not be of the same length. And the fact that other associated structures such as menisci and other intra-articular structures provide stability means that even if it does heal, it can lead to instability of the knee with day-to-day activities or especially playing twisting sports. I would say that surgery is only required if the ACL injury is causing symptoms. If you're going to be playing a sport that involves twisting of your knee, and it's a very high chance you'd re-injure yourself, or if you're having instability with day-to-day activities. The surgery we do not do in what we call as a hot knee or an acutely inflamed knee. The first 5 or 6 weeks is utilized to allow the knee to settle down, for the swelling to settle down, for the pain to settle. And once the knee is nearly normal, that's the best time to reconstruct the ACL if it's required. Yes, this is becoming more topical now that people are trying to preserve the remaining part of the ACL and reattach it back to place. So if the two ends of the ACL are repaired back together and stitched back together and reinforced, that's called an ACL repair. The ACL reconstruction involves using other tissues from your body, such as the patellar tendon or the hamstrings, to replace the function of the cruciate ligament. ACL repair is becoming popular, but the data still seems to suggest that the reliable operation is reconstruction rather than repair, except in children who have exceptional healing ability. And we are always concerned in children about the possibility of damaging the growth plates. And therefore, I would probably think of repair rather than ACL if required in children, and if it's possible to do that in that individual child. That depends very much on the type of injury, the amount of symptoms, and also the ability to get good quality tissue to put back together. In general, patients require reconstruction rather than repair. Yeah. Well, it used to be a very major surgery. It involves putting patient a plaster, brace, and lots of other things. But over the years, by specialized techniques and doing them by keyhole surgery, it is definitely not a minor operation. So it is an intermediate operation, I would say, to reconstruct the ligament. It involves a period of recovery after the operation, and we often do associated operations with it to improve stability, such as stenodesis, meniscal repairs, repair of any of the other tissues that are required at the same time. But in general, I would say ACL reconstructive surgery is a reliable operation. It works in over 90% of patients. But the important thing to realize is that it doesn't give you immediate stability. The body has to incorporate the graft, and that takes anything up to 6 months in the initial period and 9 months to 1 year before you return back to sport. I think the ACL reconstruction operation is a very successful procedure. It restores stability of the knee. It also protects the menisci from further injury, and it allows patients to get back to playing sport if that's what they desire. What's important to remember is that the injury is responsible for a few things that can cause problems in the future, which the ACL reconstruction doesn't necessarily treat. And that includes damage to bruising of the bone, damage to the lining of the joint, and any other associated meniscal damage that happens at the time, which is not repairable. So while ACL reconstruction is successful in returning patients back to stability and sport, it is still the chance of preventing arthritis in the knee is definitely better, but I think is not eliminated.